So we are going to discuss a very useful point, that is small intestine 6, 7, 9, 11, 12, 13, 14, and 18. Out of 18 points, we are going to discuss 8 points of small intestine meridian. So let's start with the SI6. चलिए हम SI6 से start करते हैं. SI6 is very important point. So what is the benefit of SI6? Why the SI6 is important? Let's see now. So number one, SI6 is the G cleft point of the small intestine meridian. सबसे पहली बात, हमारे स्मॉल इंटेस्टाइन मेरिडियन का जी क्लेफ्ट पॉइंट है, मेडिकल इमरजेंसी पॉइंट है. So during the any type of the medical emergencies, we can use this point SI6 or the small intestine 6. This point is also called, the other name of this point is very well known. इसका एक दूसरा नाम है. So this is called happy old age point. इसका नाम है happy old age point, SI6. Why it is called happy old age point? Because this point is working on the aging process. हमारे यौवन अवस्था को बनाए रखता है. It is working on the youth, to maintain the youthfulness, SI6. We can see here this point. So the name of this point is happy old age point. And this is the G cleft point or the medical emergency point. We are using it frequently for the neck pain. हम गर्दन दर्द के लिए इस पॉइंट का बहुत ही frequently यूज करते हैं. As per the discussion of treatise, as per the discussion of TCM for stroke, this is a very good point for arm and scapula. यानी हम पूरे गर्दन से लेके आर्म तक के भाग के लिए इस पॉइंट का प्रयोग कर सकते हैं. If the person is suffering with the pain of the neck, SI6 is very good point. If the person is having paralysis of the scapula of the arm, SI6 is very good point, and we are using this point, we can prevent aging process. हम aging process को prevent कर सकते हैं. So this is the importance of this point. Then SI6, if you remember during our previous discussion of the treatise, we have already discussed. SI6 and 7, both points together are very much effective because SI6 is G cleft point and SI7 is Leo connecting. I will tell you the location of both the points. SI7 is Leo connecting. Let's see in this image. From the wrist crease, if we are going 5 chin proximal on the border of the bone, so this is the 5 chin that is a SI7. The total length of the lower arm is 12 chun. If we do the half, that is 6 chun. Right. So this point is SI7 is 7 chun, 5 chun above from the 5 chun proximal from the wrist region, हमारी कलाई से 5 chun की दूरी पर होता है. This is the wrist region. And this point is located 5 chun above. This is the point on the border of bone here. So if we put the SI7 here, SI6 here, the combination of SI6 and 7 both very good for neck pain, scapula problems, arm problem. Person is not able to grasp the object, not able to hold the object. अगर कोई व्यक्ति को कंधों से लेकर हाथ तक का पैरालिसिस है और वो कुछ भी पकड़ नहीं पाता, ग्रास्प नहीं कर पाता, तो हम इन दोनों बिंदुओं का प्रयोग करते हैं. SI6 and SI7. Not only we can use them for pain and paralysis of the neck to arm. गर्दन से लेके आर्म तक का पेन और पैरालिसिस के लिए हम इन बिंदुओं का प्रयोग कर सकते हैं. For maintaining the youthfulness, you can acupressure on the SI6 because SI6 is a very good point, the G-cleft point. It is not only working for the small intestine, but it is also working for heart because SI is the couple of heart. So in the old age, not only old age, if at any age, if you want to maintain the good health of the heart, you can place the SI6. आप SI6 को प्लेस कर सकते हैं, राइट. तो कैसे प्रेस करना है? सिंपल प्रेस करना है, बस इस पॉइंट को लोकेट करना है और प्रेस करना है. तो यहां पर ये पॉइंट है, यहां पर ये बोनी पार्ट है. ऑन द स्मॉल फिंगर साइड वी कैन फील द बोन हियर. इस पॉइंट को ढूंढने का बहुत सिंपल तरीका है. हाथ ऐसे करिए, ऐसे करिए और ये बोन पर अपना हाथ रखिए. ये बोन है ना यहाँ पर. कीप योर हैंड ऑन द बोन लाइक दिस. फिर पाम को अपने चेस्ट पर रख दीजिए ऐसे. यू ऑटोमेटिकली विल गो इन द डिप्रेशन. आप एक डिप्रेशन में चले जाओगे. दैट इज SI6. मिला? Did you find it? If you do the hand like this and you turn the hand, automatically you will fall in the depression. That is SI6. Very much effective point. I have tried this point for many patients for the neck pain and it's giving very, very effective, good results. If the अगर हमारे पास कोई पेशेंट आता है कि यार एक गर्दन में दर्द है, स्पॉन्डिलोसिस है, तो हम SI3, SI6, SI7 और लंग 7 ऐसे कुछ पॉइंट लगा देते हैं तो पूरे गर्दन का दर्द चला जाता. वेरी इफेक्टिव. I have tried this point for many patients with a great successful results. तो अभी हमारा ये लक्ष्य कि हमारे पास कोई पेशेंट पैरालिसिस की कंप्लेंट लेके आता है. So patient is coming with a complaint of paralysis. Paralysis in the arm, shoulder, scapula, anywhere in the arm, we can use this point. हम इस point का प्रयोग कर सकते हैं. Even these points are not only working for the arm, but they will also balance the high blood pressure if it is there. अगर high blood pressure है तो उसको भी ये बैलेंस करेंगे. Regarding the SI7, I want to tell you one thing. SI7 के बारे में आपको एक चीज ध्यान दिलाना चाहेंगे. SI7 जो अभी हमने दिखाया 5 chun proximal, from here if you go 5 chun proximal, SI7 is a very special point for fingers. So if the person is having any problem with the fingers, do not forget SI7. अगर फिंगर की कोई भी प्रॉब्लम है तो हमें SI7 का प्रयोग करना ही होगा, चाहे whether the problem the finger, trigger finger, or some nodule in the finger, pain in the finger joints, any problem the finger, we can use SI7. और SI7 is also very good point for स्टाई, यहाँ पर जो आंखों पर गुहेरी हो जाती है, SI7 is a very good point, single point SI7. So when we are putting the SI7, it is improving the finger grips. Many paralytic patients are not able to grasp something, so we can improve the grasping power. कई पैरालिटिक पेशेंट चीजों को पकड़ नहीं पाते, ग्रास्प नहीं कर पाते, ऐसे उंगलियों से बटन नहीं लगा पाते, तो हम उंगलियों की क्षमता को SI7 से बढ़ा सकते हैं। आजकल तो बड़ी अच्छी मशीनें आ गई हैं, आप उनका भी जरूर प्रयोग करिए। वो उंगलियों में लगा देते हैं और वो मशीन अपने आप उंगलियों को बार बार ऐसे एक्सपेंड करती रहती है। ऐसे हैंड ग्लव्स टाइप की मशीन्स आती हैं, है ना? है पवन जी आपके पास? अभी है, दिखाइए। नहीं है अभी? अच्छा, कुछ बोलना चाहते हैं आप? हाँ,
सर दूसरे सेंटर पे है मेरे पास।
फिर से बोलिए पवन जी।
सर मेरे दूसरे सेंटर पे है।
हाँ,
सुबह दिखाओ, कल कल क्लास में दिखाऊंगा, कल करेंगे।
सो व्हाट हैपन,
हायर वर्जन है मेरे पास सर इसका।
हायर वर्जन है ना,
जी जी।
तो कल दिखा दीजिएगा। सो नाउ because exercise also very much necessary for the paralytic patient, so you are putting SI7, but do not forget that exercise also necessary, कि व्यायाम भी जरूरी है, बिना उसके काम नहीं चलेगा। In this way, with the help of SI6 and SI7, we can work for the scapula to arm on this entire area. Now let's move to the SI9, which is the point on the shoulder area. हमारे SI9 जो कंधों पर होता है, SI9 is also very useful point in the TCM. हमारे TCM में भी बड़ा useful point है। So now we can see here, this is the posterior axillary crease and it's a one chun above, that is SI9. हमारे posterior axillary crease से एक चुन ऊपर होता है। It is very good for paralysis of the arm. We are using this point for paralysis of arm, that is SI9. We can see here, this is the SI9. This is also called the master point of elbow. इसे हम elbow का master point भी कहते हैं। If the person is having any type of the problem of the elbow, like the tennis elbow, golfer elbow, pain in the elbow, multiple problems of the elbow, like lateral epicondylitis, medial epicondylitis, whatever the problem of elbow, we can use this point. SI9 is called master point of elbow joint. Definitely, it's a very good point for the paralysis of the entire arm. हमारे पूरे आर्म की पैरालिसिस के लिए बहुत ही शानदार बिंदु है, लेकिन एल्बो जॉइंट का स्पेशल पॉइंट है, राइट? सो इन दिस वे SI9 इज इंप्रूविंग द सर्कुलेशन ऑफ आर्म। हमारे आर्म का सर्कुलेशन इंप्रूव करता है यह बिंदु, राइट? देन SI11. Now look at here, SI11. SI11 is the point located on the scapula. If we divide the scapula in three parts, अगर हम ये scapula को तीन भागों में बांट दें, upper 1/3, middle 1/3 and lower 1/3, so it is located at the junction of upper 1/3 exactly in the center of scapula, that is SI11. हमारे exactly scapula के center में होता है। और इसका नाम है SI11 and it's a very good point for the shoulder paralysis. Some effect of the paralysis which is coming in the shoulder and neck. Paralysis का कोई भी प्रभाव जो शोल्डर में आता हो या फिर नेक गर्दन में आता हो. ओके. तो कई बार क्या होता है कि हमारे पास जो पैरालिसिस के पेशेंट आते हैं उनकी कुछ कुछ मूवमेंट डिस्टर्ब होती है. फिजियोथेरेपिस्ट लोग इस काफी मूवमेंट्स पर वर्क करते हैं, जैसे हाथ लेटरल नहीं जा रहा है, मीडियल नहीं जा रहा है, मतलब कुछ मूवमेंट रिस्ट्रिक्टेड होती है. एज यू प्रेस द SI11, आप जैसे ही SI11 को प्रेस करते हैं देन यू कैन टेक द आर्म लेटरल, आप आर्म को दूर ले जाने की क्षमता को बढ़ाते हैं. वी आर टेलिंग एबडक्शन, आर्म को ऐसे दूर ले जाने की क्षमता बढ़ जाती है. आर्म कैन गो लेटरली एंड एबडक्शन, आर्म विल गो लेटरली एंड एबडक्शन. तो किसी का आर्म, जैसे कई आपने देखा होगा पैरालिटिक पेशेंट का हाथ ऐसा हो जाता है, ऐसा. सो you can take laterally and abduct the arm with the SI11. SI11 गर्दन से हाथ के संबंध को ठीक करता है. A location, let's see the location once again. SI11. So we have to find the scapula bone and the upper 1/3 of the scapula bone. This point is located. So we are dividing the scapula bone in 3 parts, and upper third, this point is located. Okay. So SI11 point is very effective. Now look at here, SI12. SI12 point located on the upper border of the scapula. ये हमारे स्कैपुला के ऊपर होता है. ये भी स्कैपुला की मूवमेंट को, पैरालिसिस को ठीक करता है. वी कैन फील हियर द स्पाइनस प्रोसेस ऑफ द स्कैपुला and the upper border of the scapula point is located. So let's see here, this is the scapula bone. ये हमारी स्कैपुला. So scapula bone is like this. So this is the upper border of the scapula. This is called spinous process. ये scapula we are looking. Spinous process of the scapula. Here we are having SI12. यहाँ पर हमारा SI12 है. यहाँ पर था SI11. SI11 is here. SI12 is here. Both working for the paralysis of स्कैपुला. दोनों ही हमारे स्कैपुला के पैरालिसिस पर काम करते हैं. So now let's see here. Yeah, we can consider near GB21 years.
Ping Fong, small intestine.
Now let's see here. SI12 Now we are seeing the SI13. अब हम SI13 की बात कर रहे हैं. ये था हमारा SI12. Now we are going on the inner border, that is SI13. SI13. Right? So from the, again you can feel the upper border of the scapula bone. आप scapula bone का upper border feel करो. On the inner corner, that is SI13. So SI11, SI12, SI13 here. ये हमारा SI13. We are having two scapular bones. ये हमारी दो स्कैपुला बोन है ऐसे. तो SI11, 12, 13 on the inner core. So we can feel it. This is the 13. Right? We can palpate and we can feel. At the level of thoracic 2 vertebra, ये हमारा thoracic 2 vertebra के लेवल पर है. At the level of thoracic 2 vertebra, this point. This is also good for paralysis of the scapula in arm. तो जब किसी को आर्म की पैरालिसिस होती है हमें सारे पॉइंट्स खोलना पड़ सकते हैं. Not only paralysis, even someone is suffering with the neuralgia of the arm, shoulder pain, frozen shoulder, any problem of the shoulder. We can use these all points. We can find the tenderness. We can do the massage, whichever points is, especially for the paralysis of scapula. Right? Then SI14. SI14. SI14 is very common point. SI14 को हम जानते हैं. Right? Now I will tell you the SI14. SI14 पॉइंट को समझने के पहले हमें ब्लैडर 11 को समझना पड़ेगा. तो चलिए पहले हम ये एक वीडियो देखते हैं. ये सारे लोकल पॉइंट्स हैं. So at the level of thoracic 1, below the T1 we have bladder 11. thoracic 1 के लेवल पर हमारा bladder 11 है. उसी की लाइन में हमारा SI14 है. SI14 is exactly on the line of bladder 11. So now we can also see in this image, this is a thoracic 1. Below that, if we go 1.5 chun, that is bladder 11. If we go 3 chun, that is SI, this point. Right? This is the point of SI. So bladder 11 and SI14 located on the same level. Again, paralysis of the scapula, any problem in the arm. यानी हमारा SI14 और ब्लैडर 11 का एक ही लेवल है, लोअर बॉर्डर ऑफ T1, हमारी T1 का लोअर बॉर्डर. Then SI80, SI80. This is the last point of SI meridian. On the lateral corner of the eyes, if we go down, this is the location of SI18. अगर हम आंखों के lateral corner से नीचे जाते हैं तो just below the zygomatic bone, this is the SI18. This is the last point of SI meridian. We are using it for facial paralysis and the spasm of face. इसका प्रयोग हम facial paralysis के लिए करते हैं. That is the final point of small intestine. There is a very important indication of the SI18. SI18 is the very effective point for ear also, कानों के लिए. हमारे कानों में एक नर्व जाती है जिसे बोलते हैं 8th cranial nerve, which is going in the ear. Or the other name of that nerve is vestibulocochlear nerve. Vestibulocochlear nerve. Cochlear, which is supplying your ear and responsible for many problems like tinnitus or multiple problems. SI18 is a very good point for this nerve. हमारी इस नर्व का यह स्पेसिफिक पॉइंट है. तो ये हमने SI मेरिडियन के कुछ पॉइंट्स की बात की हमने. These points we can use for the different type of paralytic conditions. So we have discussed 6, 7 in the arm, 9 on the shoulder, then 11 on the scapula, then 12, 13, फिर हमने 12, 13, 14 और 18 पॉइंट की बात. So we have discussed the point of the SI meridian. Now let's move to the UV channel. अब हम UV channel की ओर आगे बढ़ रहे हैं. There are too many points in the UV channel. UV channel में बहुत points हैं. Quickly we'll discuss the points. हम धीरे धीरे करके कुछ points का discussion करेंगे. Let's start with the UV4, 7, 9 and 10. सबसे पहले हम ये 4 points की बात करते हैं. So look at this. UV meridian is starting from the corner of eyes, UV1. Then the first point, the UV1, then UV2 on the eyebrow. In the medial corner of the eyebrow, that is UV2. Then the UV meridian going up, reaching on the hairline, that is UV3. Then going, so if this is the UV3, Going outer side, UV4. So 1, 2, 3, and 4. So the 4 number point is 1.5 joule away from the central line. Then 5, 6, 7. The 7 and 8 is coming here. DU20 will be here. DU20. 7 and 8 is coming at the level little here and there of the DU20. हमारे DU20 के आगे पीछे हमारे 7, 8 आ गए. UV7. पहले हमारा ये आ जाता है UV7 and UV8. 7 and 8. The 9, 10 going on the back side. The 9 point coming at the level of EOP. यहाँ पर EOP होता है हमारा external occipital protuberance. At this level, UV9. And exactly down near the hairline UV10. तो ये हमारे मुख्य पॉइंट हैं जो हम यूज करते हैं पैरालिसिस में. UV4. I told you 1, 2, 3, and 4. 4 is 1.5 to letter. Then 7 near the DU20. Yeah, it is a 1.5 to 1.5. Then 9 at the level of EOP. Then 10 where the hairline ending. Near about that. So first I would like to tell you UV4 is, now we are trying to understand these all things. Number 1 UV4. We are using UV4 for facial paralysis. हम UV4 का प्रयोग facial paralysis के लिए करते हैं. As per the scalp acupuncture, हम जानते हैं, we can imagine the entire body here. So here is the face, here is the chest, here is the abdomen, and here is the genitals. So we can use this area for the face. UV4 we are using for facial paralysis. Right? It is a very good indication. Now we are coming to the UV7. I told you. So if this is the DU20. Before that, here is the UV7. देख लेना आप location, you can see the location, UV7. If this is the DU20, before that, we are having one UV7 here, one UV7 here. Okay, UV7. UV7 is very good for point for improving the muscle tone. हमारे मुंह की muscle tone. Suppose someone is not able to speak properly or not able to use the muscles of the mouth properly. UV7 is also a very good point for improving the tone of the mouth muscle. इस पॉइंट पर हम निडल लगाकर अपने चेहरे की मसल्स की टोन को इंप्रूव करते हैं. So face, then mouth, face, mouth, then nose. UV9 for nose. So at the level of EOP, if we are coming to the UV9, that is a very good point for the nose. So improving the smell power. If the person lost smell power, maybe after the paralytic attack, with the UV9, we can improve the smell power, olfactory sensation. हम olfactory sensation को improve कर सकते हैं. It is very effective. UV9, right? एंड और वैसे भी जो ईओपी निकला रहता है, जैसे पीछे नाक की तरह निकला रहता है, इट्स लुकिंग लाइक नोज ऑन द बैक साइड. So we are working on the UV9 for smell, nose or olfactory sensation. Sensation के लिए यूज करते हैं. Then finally UV10 near the hairline. We are using UV10 also, UV9, UV10 using for same purpose, improving the olfactory sensation. But UV10 is very good point for this part because all the point of the hairline, UV10 is good point for this local part. Pain, some spasm, contracture, any problem here on the back side. तो हमारे 4 पॉइंट्स हैं. एक बार क्विकली मैं आपको 4 पॉइंट्स दिखा देता हूं. I will show you all the 4 points quickly. Let's see now.
To try blood.
So this is the first point, that is UV4. Now we can see here from the midpoint of the hairline, we are going lateral, that is the UV3, then the UV4, which is the 1.5 चुन lateral. हमारी मध्य रेखा से 1.5 चुन की दूरी पर है. We are using at this point for facial paralysis. So this is the location of point UV4. UV4 point is not on the hairline, it's a half चुन back from the hairline. हमारी hairline से आधा चुन पीछे होता है. UV4. Then we'll see UV7, as I told you. So now we can see here. This is the DU20. ये हमारा DU20 है. And if we see little anterior, that is the UV7. And little posterior, that is UV8. UV7 is the point which we have discussed just now, which is improving the tone of mouth muscle. हमारी चेहरे की मसल की टोन को बढ़ाता है UV7. Then we are going on the back side, from पीछे की ओर जा रहे हैं. So we can see this is the EOP, external occipital protuberance or EOP. At this level we are having UV9. इसके लेवल पर हमारा UV9 है, which is very good for improving the olfactory sensation or smell power. If the person lost smell, अगर व्यक्ति ने अपनी स्मेल खो दी है, यही तो आपको मेन एड ऑन करना होता है. यू आर ट्राइंग सम प्रोटोकॉल but the person lost his smell, then you have to add this point. UV10 also, the points located little above from the hairline, half tune above from the hairline, UV10. From the so UV10 is also very good point for neck pain, spasm of the neck, or any problem happening which is connected with the smell, bladder 10. So now, after that, we are moving to the few points. that is bladder 11. Now bladder 11 onwards we'll discuss tomorrow. Okay, कल समझेंगे, कल सुबह, tomorrow morning. Done for today. Now we'll see you tomorrow morning by 8:30. We'll try to finish bladder channel because it's a very big channel. It's the biggest channels. Maybe we'll see how much we'll able to finish. Okay. So good night. We'll see you tomorrow.